بسم الله الرحمن الرحيم. نحب طلاب المرحلة الثانية في مادة التشريح anatomy. نكمل ما بدينا في البعض. نكمل ما يتعلق والآن نشرح لكم a change in the scalp. What the change between the human being from the birth until adolescence for any person. At birth, the skull forms a larger portion of fetal body length than in adults. You can see the skull size is larger than the body length. In the newborn, the distance from lower border of mandible to the inferior orbital margin is about 1/3 of the total height of the skull. The skull height is larger on the lower 2/3 from the lower border of the mandible to the lower border of the inferior orbital margin. It is the middle third and the lower third is larger in newborn in comparison with the adult skull. In adult, about 1/2 the growth of maxilla and mandible which permit teeth erupt the growth in height of maxillary sinus and the nasal cavity. This increase in the size of the skull due to the growth of the eruption of the upper and lower dentition that increase the size of alveolar process in upper jaw and lower jaw. There are sinuses within the skull. This called paranasal sinuses. This mainly the maxillary sinuses in the body of maxilla that lead to increase in height of middle third of the face. The orbits are proportionally larger in the infant than in later years. حقيقة الorbital cavity is larger in proportion due to its size is not large than in adult. It is the same as in orbit, but the size of the skull is small, so the orbital cavity is large. The skull at birth consists of a number of separate bones connected at their margin by dense membranous tissue as well as cartilaginous area, especially in the base of the skull. The bone of the skull is 22 pairs of bone that are separated by the membranous joint that separate each bone. This is become fused and form as a one bone at an adult stage and adolescence. There are structure called it fontanelles. These fontanelles that have spacing between the frontal bone and parietal bone and between parietal bone and occipital bone. This is two major fontanelles. The first one is anterior fontanelle and the last one is the posterior fontanelle. The anterior fontanelle is the diamond in shape space which is present in the midline between the frontal and parietal bone. Extension of ossification into membrane results in closure of fontanelle between age about 18 to 24 months. This fontanelle is completely calcified at this age of baby growth. The posterior fontanelle is a smaller triangular in shape area bounded by the occipital bone posteriorly and anteriorly parietal bone. It is closed at the end of first year and can no longer be palpated. We can feel the fontanelle by the press by the finger and feeling the meninges and the brain of it. The fontanelles are found at the junction of greater wing of sphenoid bone with the temporal and parietal bone. We have a small fontanelle between frontal, parietal, and sphenoidal bone at the side of the skull. The last fontanelle is the meeting point of temporal, parietal, and occipital bone. This fontanelle is 4 fontanelles present in the skull. The benefit of this fontanelle is for the spacing to be delivery there are compressed the bone of the skulls to be at a time of delivery cannot lead to any damage to the brain if it is closed. So the closure of this fontanelle early in the embryonic life the lead to damage and lead to brain damage and a mental retardedness at the newborn baby. So it is very beneficial of the fontanelle and spacing between these two bones and for delivery. Second thing, the growth of brain is more rapid than the growth of the bones. So expansion of the brain is faster. That needs spacing to be an expansion of the skull space. So it become if it is closed, the brain become not limited in growth, so it become mental retarded. So to this benefit that have fontanelles and there are not fused sutures of the skull. In newborn baby, the edge of bone are not serrated in infancy. The growth takes place at the edge so that whole volume of skull increase. Growth of valve stop at the age of 16 years. The suture between the squamous and tympanic part of temporal bone, the suture between the greater wing of sphenoid bone and the remainder of that bone, this suture disappears during first year of life. The two halves of frontal bone begin to unite during the second year and this is completed by 6 years. Expansionally, a median suture persists throughout the life and is called metapic suture if the two sides of the frontal bone have a remaining suture between two left and right side of the frontal bone. After 20 years, the suture being disappear in old age, the bone becomes lighter and thinner due to the osteoporosis and the loss of calcium deposit in the bone. The skull become lighter and become easily fractured in older age. We have paranasal sinuses are present at birth except for small depression in the wall of the nasal cavity, which represent the beginning of maxillary and sphenoidal sinuses. We have 4 pairs of sinuses in the skull. The front sphenoidal sinuses in the body of sphenoid bone, and we have ethmoidal sinuses, 3 anterior and middle and posterior ethmoidal sinuses in the body of the ethmoidal bone, and we have the frontal sinuses in the frontal bone in the horizontal plate of frontal bone at the upper border of the orbit, and we have in the body of the maxillary bone the maxillary sinuses. With the enlargement of the facial skeleton, the nasal cavity becomes relatively larger from above downward, and the orbits become more widely separated from the mouth. At the same time, the hard palate sinks to a lower level relative to the posterior part of the skull. With the growth of the face, there is a gradual forward extension of vomer at the expansion of septal cartilage. So, all the middle third of the face become enlarged by enlargement of the nose anterior posteriorly and superior inferiorly, so it is in the size of the palate and the size of the floor of the nose and the roof of the oral cavity. We have extensive change occur in the mandible from birth until old age. The mandible is very changing in its shape and size. The two halves of the mandible are connected as symphysis menti by fibrous tissue until the age of 1 year, when bone union occurs. The two halves of the two sides of the mandible at the symphysis menti become fused at 1 year and forming as a one bone as horseshoe appearance that have the body and the ramus of the mandible. The mandible shows striking change associated with the growth and eruption of teeth. Due to presence of lower dentition, the primary dentition that grows from 6 years until reach to 2.5 years complete primary dentition. And this growth, the alveolar process with it. And then from 6 years to the 13 years, the growth of permanent dentition that present beneath the primary dentition and lead to more large growth of the body of the mandible, so that have increased in size anterior posteriorly and superior inferiorly of the mandible. As the birth alveolar process of mandible is larger and contains not only the crown and root of primary teeth, but also elements of the permanent teeth. We have not only the primary dentition present in the mandible, but also the permanent germs that have grown in the lower alveolar process and exact like the upper maxillary process. The part of mandible below the alveolar process is poorly developed so that the mental foramen is relatively close to the lower margin of the bone. There are no any eruption of primary teeth. The body alveolar process is larger than the base of the mandible, so the mental foramen is nearer to the lower margin of the mandible due to the presence of alveolar process and primary dentition and permanent dentition. When the growth of permanent dentition, the body of the alveolar process is equally in the size, and there are this size come due to presence of permanent dentition and the full development of the process. After extraction of all dentition, the alveolar process become dissolved, and due to the mass theory, functional theory, no any function for alveolar process, so distorted, and only the base of the mandible stay in the lower jaw. We have at complete permanent dentition, the natural teeth present all the alveolar process is full developed, and there are alveolar process and the base is equally in size. After extraction, the alveolar process become dissolved, and due to not present any function to the process, there are removed of all alveolar process, and by time this if not do any complete denture, the alveolar process become dissolved. If you do a complete denture, the remnant of alveolar process is stay, but if there are not complete denture, or if adequate the spacing between maxilla and mandible, so high pressure that lead to a resolve of alveolar process, and only the body of the base of the body of the mandible is present. So this resorption after 10 years, this figure, and this resorption after 13 years, and you can see the difference between two and the difference between upper and lower figures. Absorption of alveolar margin after the teeth have been shattered or extracted. During the eruption of the teeth, the body of the mandible elongate as there is simultaneous absorption in addition to bone onto the anterior and posterior border of the ramus respectively. During this, the not only superior inferiorly, anterior posteriorly enlargement of the dentition that present within the body, so read enlargement of the ramus of the mandible. At birth, the ramus of the mandible projects only a little above the level of alveolar margin, and the angle is very obtuse. The angle of the mandible, that is connection between ramus and the body, about 175 degrees, and the time of eruption of primary dentition. After the permanent eruption and formation complete dentition, in old age the angle becomes less obtuse at about 140 degrees, and during removal of the permanent dentition, the angulation becomes less than the mandible. In general, the all skull that elongated from anterior-posteriorly and superior-inferiorly that have become the face and the skull, the facial bone and the cranial bone that have enlarged. The base of the skull is enlarged anterior-posteriorly, and the size of the cranial fossa enlarged due to enlargement of the brain and enlargement of paranasal sinuses and the deposit of upper and lower dentition. We have is the change in the age of any person. We have variation in the shape of the skull in gender. The gender means sex. We have two sexes in the human being. We have male and female. What's the difference between male and female skull? The male skull, you can see in this figure, is larger and heavier. It's larger than female skull, and it is heavier than female skull, but not difference in the mentality of the female and female. The muscular invasion are more marked, so the angulation of the male is more acute angulation and permanent angulation than female is more rounded angulation and is not uh, so marked that have become this roundness is more than in male. The muscle process and superciliary ridge are larger in male than female. The superior orbital margin is more prominent and large in male than female. And at the side of the skull, we have the mastoid process that's present. The sternocleidomastoid muscle is stronger in male, so it becomes more prominent in male than female. The female skull a capacity about 1/10 less of the same races. In the same races يعني القوقازي عن الآسيوي عن الإفريقي there are the difference in 1/10 in female than in male. The facial skeleton is smaller in proportion. The skeleton of the female is more round and smaller than skull at the same age and the same race. But this may not have a difference in mentality. The mentality is the same in male and female. The jaw are narrower and less prominent due to its muscular or facial expression and muscle amplification is stronger in male. The jaws are narrower and less prominent in female that give the face shape is more acceptable in female. This difference is very difficult to determine with certainty. The sex of the sex of an individual by means of the skulls. Thank you for your attention for this lecture, the first lecture.